I'm Dr.Pinky Deviayyappan. I'm a board certified plastic surgeon practicing at pinkappleaesthetics, Bengaluru. This week, I'm going to demonstrate all the common indication wherein we are using Botox. So, Botox is a neurotoxin which will temporarily inhibit the neuromuscular junction and cause paralysis of certain muscles. So, this particular action of Botox, that is paralyzing certain muscles, can be used judicially in for certain cosmetic benefits, like we can treat the crow's feet, forehead line, the glabellar line, hypertrophic masseter muscles, hypertrophic glabellar, hypertrophic mentalis muscles, excess sweating, and many more. So this week I am going to show you all these common indications. So to begin with, how do I formulate? How do I use Botox, and what are the dilutions I do? So this, as you can see, is a 50 units Botox vial. This I am going to use today for a patient who has bilateral masseter hypertrophy. Okay, so I am just opening the. This needs to be kept in the fridge. It has to be maintained cold storage. For this particular patient today, I am going to use 50 units completely. So I'll be using 25 units on each masseter muscles. Right. So this is a vial. This is how the Botox vial looks like. As you can see, it's a clear bottle. And the Botox is just tiny powder particles at the base of it. Okay, to the extent that you sometimes feel it's the empty vial. Okay, so once we have taken this, I'm going to dilute. My dilution is 100 units with 2.5 ml of saline or distilled sterile water. So since it is 50 units, I'm going to use 1.25 ml of distilled water, which will give me a concentration of 40 units per ml, which I find it much more easy to calculate and inject in the patient. Okay. So how do we know this has been vacuum sealed or not? So when you introduce the partially empty needle, empty syringe into it, it should suck in air. See, you could see. So the vacuum was intact. So this vial is good. I have taken this 1.25 ml of sterile water and I am going to dilute my Botox with this. Okay, so gentle movement. Botox vial needs to be gently handled. We are not going to shake it. We're just going to introduce the fluid and liquid in it, and this is ready. And this is ready to be used now. So normally what I do is I use insulin syringes. 1 ml of syringe, this has calibrated to 40 units. So each line or each unit is 1 unit of Botox. So it's much easy for me to calculate and inject Botox with this. Now we are going to go ahead and see how I inject for masseter hypertrophy. So we have already seen the preparation of Botox earlier. Now I am going to inject Botox for masseter hypertrophy bilateral. So in her I have been injecting 25 units on each side. But right is a little more hypertrophic, so I'll be injecting 2 to 3 units more on the right side. So let's see how we do it. Clean the area. Mark the upper limit, the mandible border. Clench your teeth now. Ask the patient to clench the teeth. So you can see this is the bulk of her muscle. As I said, I will follow 3-point technique. So I have taken the prepared 50 units of Botox. So on the right side I am injecting around 28 units, which I have filled it in a syringe, 1 ml syringe. This I will be injecting as 3 points. You go. Again confirming the muscle. Relax now. Clench your teeth. Yeah. So we just ice the area. The second point. The third point. And we'll be icing it. It's okay. Just keep it. As you see, Botox is a simple procedure done easily under OPD thing, and the effects starts to be shown only after 48 hours, and the maximum effect will be at 7 days. The results last normally anywhere between 3.5 to 4 months. Thank you.